Hello everyone. So I'm Dr. Shikha Garg. So we are already discussing a lot of diseases so commonly present in the population with a very high incidence or prevalence. So in that series today we are going to discuss tuberculosis or TB. It's a very common thing, very common disease, and more or less people are affected with the pulmonary TB, that is the TB in the lungs. So you get the common symptoms. Apart from the pulmonary TB, you have extrapulmonary TB. Almost 15% of population presents with the extrapulmonary TB, and 85% have the pulmonary TB. So we will discuss further in detail all about the symptom, all about the treatment options, testing modalities, and everything related to TB. What is TB? Why is it? What are the risk factors, etc. Before discussing that, I would just like to throw some light on the burden of the TB. So 40% of the population of India is affected with TB. So that's a huge number. And almost those people have latent TB. So we'll discuss in detail what is latent TB. So all those people, they might initially, because it's a latent TB, it does not really show symptoms, so they might really go undiagnosed. So it is very important that at a good time you get to know the symptoms, you get tested repeatedly if needed, and get to the treatment options available. It's a long-term treatment options needed. Almost 6 to 9 month treatment is needed. So definitely it's not really easy to take. But if you get a TB and if you are diagnosed positive, its treatment is really effective as well. So of course it's something bothersome. I will not say it will not affect the quality of life. It will, but at least it is curable. It is treatable. You cannot say TB is not curable or treatable. Very rare cases in which there is multi-drug resistant TB, in which people already had TB, were diagnosed initially, they did not take the treatment completely, or there are cases of relapse. On those cases, there could be a multi-drug resistant TB, and that could be really dangerous or fatal, or can cause even the death or the mortality. So as per the norm or the data available on the Indian stats, there is a better health group now available. Like the initial burden in like 2007 to 2017, that decade had a lot more TB people. The incidence now in 2021 to 22 has reduced as compared to the previous one. That is definitely because of the better knowledge in the people, better treatment options, better compliance of the patient taking the treatment available. And one thing very important is the treatment options and the diagnostics part. Everything is available free of cost with the government sector. And specifically, the treatment part is only available with the government sector now to reduce the multi-drug resistance. So they have the boxes available which are given to the patients as per their need, as per the treatment need options available. For the further details, we are going to discuss in the form of a PPT, where we will discuss what is. We are discussing tuberculosis today. So what is tuberculosis? What are the sites of tuberculosis? How it spreads? What is the difference between latent TB and the disease? What are the symptoms, risk factors, transmission? How is it tested? And what are the treatment options available? So what is TB? It is a disease caused by bacteria called Mycobacterium tuberculosis. It spreads from person to person through air, and not everyone infected with the TB germ will become sick. So what are the sites of TB? 85% are all the pulmonary TB, which is the TB in the lungs. Rest 15% are extrapulmonary TB, which occurs in the places other than lungs, which include larynx, lymph node, brain and spine, kidneys, bone, joints. In females, uterus could be one of the area. And there are other many options available for the TB to be there. Lymph nodes is very common thing. Miliary TB occurs when the tubercular bacilli enters the blood and it is carried to the all parts of the body. So TB is the world's top cause of death due to infectious disease. It's not a disease of the past. Too many people in India still suffer from TB. 40% of population has latent TB. With 28% cases globally, India was among the 8 countries accounting for almost 2/3 of the TB burden. It's a serious disease and can cause a person to become very sick if not treated with medicine, and it can be fatal also. Treatments are available to prevent and cure TB. So it is a preventable and a treatable and curable disease. So how it spreads? We discussed it spreads through air to air from person to person. When someone with the TB coughs, that TB cough has that aerosols which can take the bacteria from one person to the other person. So it does not spread by sharing toothbrushes, saliva from kissing, shaking someone's hand, touching bed linens or toilets, sharing food, drinks or utensils. So not everyone exposed becomes infected. Probability of transmission depends on the infectiousness, type of environment, length of the exposure. So 10% of the infected person will develop TB at some point in their lives, with 5% within 1 to 2 years and 5% at some point in their life when the immune status of the patient becomes in any way compromised. So what is the difference between the latent TB infection and the disease? So these are the two conditions. Latent TB is people with latent TB, they do not feel sick, they do not have symptoms, they cannot spread TB germs from one to another. They can have latent TB infection for years. So they have a small amount of germs in the body or the bacterial in the body that are alive but they are inactive. So they can develop into a disease anytime in their life, when either due to malnourishment or due to acute stress or due to immunocompromised state or due to any trauma, if any. So what is the disease? It's an active situation condition where the TB bacterium, they are active and they are multiplying and thus showing all the symptoms of the disease. So not everyone who's infected with TB becomes sick. So person with TB disease would have large amount of active TB bacteria. It will spread from one to another. They will feel sick. They will have symptoms like cough, fever, weight loss. They will have usually positive skin TB test and blood test would be positive and they need treatment. So untreated latent TB infection can lead to TB. If the immune system can't stop TB mycobacterium from growing, they become active and it is called a disease. And most people diagnosed with disease in India become sick after living with latent TB for years. Latent TB infection treatment is 90% effective in preventing the development of TB disease. But the catch is in the diagnosis of the latent TB. Because it is not showing symptoms, so it is difficult to diagnose it because people do not present to the doctor sooner. So it is called the tip of the iceberg phenomena, where people with TB disease who are having symptoms, who are showing the symptoms, they are developed the TB, that are only visible. But the major chunk or the major load is actually the base of the iceberg, which is the TB patients with the latent infection. So they do not feel sick, they do not have symptoms, so they cannot spread directly. And when they become active with the disease, then only we can see it. So millions of the people in India have latent TB. Without treatment, they are risk for developing TB. So what would be the symptoms? It would be night sweats, fever, chills, weakness or fatigue. There could be a weight loss, no appetite, coughing lasts more than longer than 3 weeks, pain in the chest or coughing up blood. So people with TB disease are sick and can spread TB germs. TB is a serious condition and can lead to death if not treated. It can almost always be treated and cured with medicines. A person with TB disease typically requires X-rays, 6 to 9 months of treatment depending upon the type of TB, lab test for the investigation and for the diagnosis, and follow-up and testing for the close contacts. So what is infectiousness? Patients should be considered infectious if they are undergoing cough-inducing procedures, they have sputum smear positive for AFB, that is the acid-fast bacilli, and they are not receiving treatment or having just started treatment or have a poor clinical or bacterial response to the treatment. They have a cavitary disease which could be seen on the X-rays. Extrapulmonary TB patients are not infectious. So infectiousness patients are not considered if they meet all these criteria. They have received adequate treatment for 2 to 3 weeks. They have favorable clinical response to the treatment and 3 consecutive negative sputum smears results from the sputum collected on the different days. So how is it transmitted now? So techniques to decrease TB transmission is instruct the patient to cover the mouth when coughing or sneezing, wear masks, open windows to ensure proper ventilation, do not go to work or school or anywhere confined place until instructed, avoid public places, limit the visitors, maintain home or hospital isolation as ordered. So what are the risk factors? So, who is at the risk for becoming infected with TB? Anyone can get TB. Some people have a higher risk of getting infected. Those have the contact with someone who had infectious TB, or those who were born in certain countries like even in India, China, Mexico, Philippines, Vietnam. These all other countries, they are actually having a high rate of TB. So sooner or later you might get infected. Healthcare workers and other workers also who live in close contact with the patients, or in the homeless shelter, caregivers, in the jail attendants, these people are more prone to TB. So, who is at risk is the people at high risk are generally fall into two categories: those who have been recently infected, and those with medical condition that weaken the immune system. So, then other infection are the HIV infection, substance abuse, specialized treatment for rheumatoid arthritis or Crohn's disease, organ transplant donors or recipients, severe kidney disease, low body weight, silicosis, medical treatments such as corticosteroids, diabetes, head and neck cancers. These all people with all these conditions are more prone to TB because the immune status is compromised. So, how do we test it? So, evaluation needs medical history, physical examination, tuberculin skin test, chest X-ray, bacteriological examination. So, two type of tests can be diagnosed: TB blood test or the TB skin test. These are the initial screening tests. So, either of them is positive, then we further go in for the confirmation. So, blood test is called the IGRA and TB skin test is called the MONTU test. So if the blood test is positive, blood is taken and we go in for the interferon gamma release assay IGRA test. If it is positive, likely patient can be infected. But we need another test, additional test to confirm the TB. So if it is negative, it does not rule out anything. Same is with the MONTU test. It is a skin test in which we inject the person with the 5 ppd units, and then we check for the wheel and reaction, and we check it at the 48 to 72 hours. But almost everyone had BCG. So BCG can give the false positive MONTU, or people who are exposed to minor doses like healthcare workers, they can have positive MONTU, but that does not really rule out the TB, and that does not really confirm the TB as well. So what are the groups to target with the skin test? Person who are at risk of HIV, close contacts of person with infectious TB, person with certain medical conditions, injection drug users, foreign-born persons who are from the area where TB is common, like foreign countries like China, Philippines, etc. Medically under-reserved low-income populations, residents of high-risk congregate settings, and locally identified high prevalence groups. So people vaccinated with BCG still can get TB disease. Of course, we take the vaccine to prevent the TB. Everybody is getting that vaccine. But still, it is not 100% reliable or vaccine to prevent TB in the long term for the whole of the life. So it is not widely used in India. Used to be called initially, but likely now every child who's born now is receiving BCG. So TB blood tests are preferred for people who have received a vaccine BCG, because BCG will give false positive skin test. So X-ray tests, they are very important to rule out the TB and for the initial diagnosis, because positive X-ray findings can be seen. Abnormal X-ray test cannot confirm the diagnosis, but can be used in conjunction with the other diagnostic indicators. So it is also one of the screening methods. So another diagnostic method is the sputum collection. We take the specimen for the 3 consecutive days, and then we go in for the staining, that is the AFB-Zn staining, and of course for the culture also for the confirmation of the TB. So spontaneous morning sputum is as a desired specimen, and it is collected before the treatment is initiated. So smear examination is done by the microbiologist, and subsequently, if it is positive, you are positive for the tuberculosis. Any smear positive is considered a positive case. So culture is, again, there is a gold standard basic culture, which is an LJ culture, or rapid cultures are available. A midget and blood cultures are also available. These are the quick methods for the diagnosis of TB. Another advantage of the midget and other blood cultures is we can also check for the sensitivity of the antibiotic treatment given. So RT-PCR, MTB, Gene Expert, it is an ability to detect rifampicin resistance simultaneously. It's a very quick test, like maximum 1 hour test. Similar is the TrueNet. These are the RT-PCR. These are very, very wonderful tests because they gives us the bacterial load and also for the treatment options available. If there is a resistance, we can see it and we can change the regime. So it's a wonderful test available and it has a very high specificity and very high degree of sensitivity. Except from the blood and stool, every other sample can be processed in this. So what are the treatment options? TB germs in the body of someone with latent TB are inactive. So of course they will not have the symptoms. So that treatment of course is of shorter duration. And in fact even the treatment regime is also of the shorter medication unit, like there are like many anti-TB drugs are available. So we give the minimum treatment option. We start with that only. So treatment for the latent TB can prevent the development of TB disease. TB germs in the body of someone with latent are inactive, so they will not feel sick. So when we treat that, they will not develop into the disease. So it is of course shorter, it is less costly, and definitely will have fewer side effects because the drug regime is also the shorter one. So it includes isoniazid, rifampicin, pyrazinamide, ethambutol. So depending upon the state and the situation and the TB bacterial load, we give the antibiotics in the form of either isoniazid, rifampicin, pyrazinamide combination or the combination of the all four. So there is an intensive phase and then there is a continuous phase. So we need a patient to get treated from 6 to 9 months variable. So never add a single drug to the failing regime, or otherwise also never start with a single disease, and we adjust the regime and the drug susceptibility according to the patient's symptoms and also according to the tests and the antibiotic sensitivity available. And we promote adherence and ensure that the treatment is completed. That is very, very important because otherwise there would be a multi-drug resistance, and that is a fatal condition where there's a high morbidity and high mortality. As the bacteria become resistant, we are left with very lesser choices, and they might not be really effective also, and there are many adverse effects with those antibiotics because they are mostly injectables then. So it is called directly observed therapy dot treatment. Healthcare workers watches the patients follow each dose of medication. It is the best way to ensure adherence. Should be used with all intermittent regimes, and it reduces relapses of disease and acquired drug resistance. So instructs patient TB medication to immediately report the following. This is the clinical monitoring. If the patient is having rash, nausea, loss of appetite, vomiting, abdominal pain, persistently dark urine, fatigue or weakness, persistent numbness in the hands or feet. So drug resistance, primary infection with the strain of Mycobacterium tuberculosis, that is already resistant, and acquired could be because of the inappropriate or inadequate treatment or might be due to the relapse. What are the barriers to the adherence? There is a stigma. There is a lot of stigma for the TB. Extensive duration of the treatment, long-term duration, it definitely causes a burden on the patient. Adverse reactions to the medications. There is a concern of toxicity, lack of knowledge about the TB and its treatment. So how do we improve it? We educate the patient. You start with the directly observed therapy, that's a DOTS therapy. We actually focus on the case management, and we of course provide the incentives. So the treatment option for the TB are available free of cost at all the government centers. Even the diagnostic portion is also available free of cost at all government centers. And government is providing under RNTCP the incentives to the every person who is affected with TB. Almost 500 rupee per month is given for the diet in their bank account directly, so that they can have a better diet, of course, so that they can have a better immunity and the TB treatment could be better effective. So what are the measures to promote adherence? Develop an individualized treatment plan, provide culturally and linguistically appropriate care to the patient, educate the patient about TB, medication dosage and possible adverse reactions, use incentives on enablers to address barriers, and facilitate access to health and social services. So on the completion of the therapy based on the total number of dose administration, not on the duration, and extend or restart if there is prolonged or frequent interruptions or the patient is not completely cured. So what are the challenges? They prevent TB by assessing the risk factors. If the risk is present, perform the testing. If test is positive, rule out active disease. If active disease is ruled out, initiate treatment for latent, and if treatment is initiated, ensure the completion. So this is kind of a cycle. So what is the important thing is to remember is to decision to test is a decision to treat. So that's very important to know. So any further questions regarding the TB, any regarding the testing, regarding the symptoms or anything further, feel free to ask the questions. I would really love to answer all your queries. Thank you.